Did you know, Ilham, that sometimes because a simple blood test is not done, a child may have to live their entire life with the disease?
Yes, Anujana. Today we are going to talk about thalassemia, a genetic blood disorder. Simply, thalassemia is an inherited condition that affects the body's ability to produce healthy red blood cells, which leads to anemia. Because of this disease, many children and families in Sri Lanka continue to face serious challenges even today.
In Sri Lanka, as well as around the world, the most common cause of anemia is iron deficiency. Thalassemia is another cause of reduced hemoglobin levels in blood. A key characteristic of thalassemia is that it is a genetic disorder. This means that this disease is inherited and passed down from one generation to another. In Sri Lanka, thalassemia is considered one of the most common inherited genetic disorders.
Anujana, I think it should be passed down from the one generation to another. By the way, Anujana, that is why our aim today is to raise awareness about this disease and highlight the importance of prevention.
Do you know why it's important to talk about this today? In Sri Lanka, around 2,000 to 2,500 children are living with this thalassemia and new patients are reported this year.
Do you know, Anujana, which areas in Sri Lanka show the highest prevalence of thalassemia?
About 3% of the total population in Sri Lanka carries the beta thalassemia trait. Among them, Kurunegala and Anuradhapura are known as with the highest number of thalassemia patients.
Anujana, because of this condition, many families face lifelong medical care which can bring emotional, physical and financial challenges as well. Therefore, it is very important that we talk about this issue.
Okay, let's see what is thalassemia is and how it can be prevented.
Anujana, thalassemia is not an infection disease. You know, it is a genetic disorder that is passed from parents to their children through genes.
Thalassemia affects the red blood cells and carries them to break down or to be destroyed more rapidly than normal, which leads way to anemia.
Anujana, as I previously said, thalassemia is a genetic disorder. Okay, it is a passed down from parents to children through generations, with the mother and father both contributing genes to next generation. According to genetic transmission, there are two methods of genetic transmission. Some diseases occur due to a mutation in a single gene known as single gene disorder. Anjana, thalassemia is one of the most common single gene disorders in the world as well as Sri Lanka. However, thalassemia is not the most genetically transmitted disease. For example, diseases like diabetics, high blood pressure can be also influenced by genetics. But the difference is that those diseases are affected by multiple gene, diet and lifestyle. Thalassemia is not caused by food or exercise habit. It occurs due to a mutation in the globin gene.
Ilham, do you know what is carrier genes means? A carrier gene means both mother and father have gene mutation but do not show them in the children. But they appear completely normal. However, when two carriers have a child together, the child may develop thalassemia major. Carriers do not show external symptoms and the condition can only be detected through a blood test.
Anujana, let's look at the symptoms of this disease. Let me go through one by one. Irritability, frequent infection, pale skin, poor appetite, jaundice and enlarged organs.
Okay, now we all know what is the disease means. So now let's talk about thalassemia can be prevented.
Anujana, if parents are aware, a child's life can be saved. Prevention is possible from blood testing before marriage, genetic counseling and career awareness. A simple blood test before marriage can save a child's life. You know, Anujana, in Sri Lanka, the National Thalassemia Center in Kurunegala provides treatment and support for patients. Again, Anujana, from where we can get the support and treatment for the patients?
National Thalassemia Center in Kurunegala.
That's a
right?
very key important fact. For the adult thalassemia patients, Anjana, I mean the big guys with the thalassemia disease, specialized care provided at the Thalassemia Support Center in Kiribati, affiliated with the University of Kelaniya and Colombo North Teaching Hospital in Ragama. In addition to Anjana, hospitals in Anuradhapura, Chilaw and Badulla also have specialized units that provide treatments for the thalassemia patients.
Okay. What should the public understand about thalassemia? Thalassemia is a preventable condition. This disease only occurs when two thalassemia carriers marry to each other. In fact, the parents of every thalassemia patient are carriers of the gene. Therefore, preventing marriages between two carriers can significantly reduce the number of children born with thalassemia. This is why it is important to take blood tests before marriage to determine whether you are a carrier or not.
Anjana, according to my research, in Sri Lanka, about 3% of the populations are carriers, which means 97% are not carriers. So if someone is identified as a carrier, they should ensure to marry from the remaining 97% of the population of non-carriers. Early diagnosis and proper treatment are also important to manage the disease and prevent complications.
Yeah, right. Thalassemia is difficult to cure, but it can be prevented.
Anujana, now let's look at a few ways we can support people who are living with disease thalassemia. Regular medical follow-ups, avoid self-medication, and future planning. Future planning means if you or your child has been diagnosed with thalassemia, discuss with your doctor the possibility of the disease affecting your future children.
What can we do to help a person who has thalassemia? There are 3 ways: blood donations, medical support, and nutrition.
Anjana, let me add another 2 facts: emotional support and prevent infection.
The awareness we create today can save a child's life tomorrow.
Anjana, one blood test, one informed decision can protect a child's future. Let us work together to build a thalassemia-free Sri Lanka.